There are common risk factors for overdose and ways to reduce the risk that you should know about. For instance, you should be careful any time your tolerance changes, such as if you've just left rehab or prison, you're using for the first time after a break, or you're starting or ending an opioid substitution program such as methadone or boop. You should make sure to be extra careful if you have had a break. Start low and go slow is a sensible principle. Another risk factor is if you're using alone or with people you don't know well, who may not stick around and help in an overdose situation. Not having someone watching your back, if you do go over, is a risk, so try to have someone you trust to look out for you. Another risk factor is the changing strength of street drugs. For example, changing dealers, etc., can mean you don't know the strength of the drugs that you're buying. You can reduce this risk by trying just half a shot at first until you're comfortable that you know how strong your drugs are. Also, if you're using in unfamiliar surroundings or rushing, this can cause you not to follow your normal drug taking routine and can increase the risk, so be extra careful in those types of situations. And especially remember the risks involved in mixing drugs, especially with drugs like benzos, alcohol, methadone. All of these combined with opioids or other opioids can cause an overdose. All of these cause your breathing to slow down, and at some point you can stop breathing and overdose. One more thing to look out for is we are finding more and more strong opioids, such as fentanyl, being mixed in with our drug supplies. And recently, people have been hospitalized and died from overdoses when they were believed they were taking totally different drugs, such as cocaine or ketamine. But in fact, drugs had included strong opioids like fentanyl. So please be prepared, just in case. Carry naloxone and save a life. It's also important to know how to recognize and respond to an overdose. Some of the signs of overdose include someone will not wake up or respond to you when you call their name. If they won't wake up, try shaking their shoulder gently and calling their name. Most people breathe at least once every 5 seconds, so irregular or very slow breathing can also be a sign of overdose. Making a choking, gurgling or snoring sound can be a sign of overdose. Small pupils tell you that the person has used opioids, so if they appear to be overdosing, it indicates it's a situation where naloxone should be used. If someone is overdosing, their fingers or lips may be blue, or for those with darker skin, grey, indicating their body's not getting enough oxygen. The person is limp or unable to move, or the person has no pulse. If you think someone has overdosed, call 000 immediately, even if you have naloxone. If you're with a friend, ask them to wait outside for the ambulance while you administer the naloxone. To administer Prenoxad, lay the person on their back and give a dose of injectable naloxone by removing the clear film wrapper and twist the plastic box to break the seals. The box holds 2 needles, a syringe containing 5 doses of naloxone and instructions. Unscrew the clear plastic top from the syringe. Open a needle by pushing it through the paper side of the packet. With the needle still in its cover, screw it onto the syringe. Gently twist the needle cover to remove it from the syringe. Hold the syringe like a pen. Insert the needle into the person's outer thigh muscle or upper arm muscle, through clothing if necessary. You don't need to remove their clothing. Push the plunger to the first black line to inject a single dose of naloxone. Remove the needle after each dose and rest it back in the box. Once you've administered the naloxone, place the person in the recovery position and check that their airway is clear. It's important to learn the recovery position so you can practice with a friend. Kneel by the person, take the arm closest to you and place it at a 90-degree angle to the body. Take their other arm and fold it across their body, placing their hand against their cheek to support their head as you roll them over. Lift their leg that is furthest away from you and place the foot of that leg on the floor. Place one hand on the raised knee, your other hand on their hand, resting by their cheek. Then use the raised knee as a lever and gently pull the person onto their side towards you. Tilt their head back and ensure their airways are open and clear. Check for signs that the naloxone is taking effect. You should see an improvement in their breathing, increased levels of consciousness, walking and talking normally. If the person begins breathing normally, do not give them any further doses of naloxone. If there are no signs of opioid overdose reversal after 2 to 3 minutes, give a second injection of naloxone by repeating the previously described steps. Second doses can be given while the person is lying in the recovery position. You don't need to roll them onto their back. The effects of naloxone can last up to 20 to 30 minutes, so it's important to monitor the person closely until the ambulance arrives and make sure they don't lapse back into overdose. If the person begins to lose consciousness or their breathing becomes shallow or irregular again and you do have further units of naloxone, continue to give naloxone every 2 to 3 minutes until the person starts breathing normally. The dose of naloxone is quite low and it won't send the person into withdrawal, but it is important that you discourage them from having another shot for at least 2 hours, as the effects of naloxone do only last 20 to 30 minutes. Having another shot earlier than 2 hours could see the person overdosing again. If they want to leave before the ambulance arrives, try to convince them to stay. Remind them that the naloxone does only last 20 to 30 minutes, so they could drop again, and the safest bet is to wait for the ambulance to give them an all clear, or at the very least to stay with you as you have more naloxone to administer should they drop again. If you want more information about overdoses or naloxone, you can call Newar's NSP on 1800 644 413 or check out our resources on our website or Facebook page.